Research Podcast. I'm your host, Dr. Wren, founder of Diverse Research Now. And today you will hear the voice of Dr. Crystal Glover. Dr. Glover is an applied social psychologist, mixed methodologist, and associate professor with tenure in the Department of Neurology at the University of California, Irvine School of Medicine. She has designed and built a program of research focused on addressing challenges related to brain health and facilitating optimal outcomes in aging for all. She also serves as the inaugural editor-in-chief of Alzheimer's and Dementia, Behavior and Social Economics of Aging, BSEA, the newest member of the Alzheimer's Association, family of scientific journalists, and a board member of the Orange County chapter of Alzheimer's Association. I mean, amazing. I'm so excited for this conversation with Dr. Glover today because it is Black History Month and it is the 100th year of celebrating Black history. So it is super special to me and I'm sure to her. And we're going to talk about the future of research and what the future of research must hold for the Black community. And so Dr. Glover is just the perfect person for this conversation. I want to thank her so much. Thank you, Dr. Glover, for being here today. And so let's get started on this conversation. How are you doing today?
I'm doing very well, actually. Thank you, Dr. Wren, for having me.
Yay! I'm so happy to have you here. Tell us more about yourself. Tell me, because we know each other from Chi-Town, Chicago.
Yes.
And so I'm so happy to have met you there. Rush University, shout out to them. But tell us more about yourself.
All right. Well, I relocated to California, Southern California.
Ooh.
Yep. And at the very end of December 2024, so really last year. And I moved from Chicago. I was living there with my husband. I was at the Rush Alzheimer's Disease Center. And I decided to give it a go out west, but I'm not from either Chicago or California. I am originally from Louisiana and not New Orleans. You know, I'm from
Southern girl.
Southern girl, more from the swampland area. I've lived all around from El Paso to Boston to New Hampshire and Colorado to DC. And now I'm here. And the thing has been the same, where it's really aiming to facilitate the optimal outcomes in aging for all of us.
Yes. Yes. Thank you so much for your work. It is amazing and kind of where we connect, right? We both are working in this space in different ways. And so I know I reached out to you to have this conversation about reflecting on the last 100 years of Black history in medicine and research. And so I know neither one of us is that old. I mean, we wasn't here 100 years ago, but we kind of know what's been going on, right? This is our field and we kind of know what's been going on. My first question is, what truths do you think the research field still struggles to fully acknowledge?
You know, I think, Dr. Wren, is two things.
Mm-hmm.
On one side, in not fully reckoning with the very real grievances that have occurred to our people. So if we think about even one of the most well-known examples would be the Tuskegee syphilis study with Black men in the South, in Alabama to be specific, where my father was from Alabama. But that ended in, I think, the 70s. Matter of fact, I know it was 1972. If you think about if someone was born in 1972, they're in their 50s. So the past lives on right now. So their children, their grandchildren are our age.
Yep.
Okay, that could be a possibility. And so people are still talking about it. The oral history is there. We remember those things historically. So I think in thinking about it as it was so long ago, but no, that's not true. It was during our lifetime. So we reflect on the past 100 years, but some of the well-known examples ended in times closer to where you and I and our siblings and our parents were alive.
Yeah.
And so we are aware of that. But then on the other side, I think fully understanding the resilience that we have as a group. We're not a monolith. We're very diverse. I'm from Louisiana, which will be very different from even some other parts in Louisiana, like New Orleans.
Yeah.
That's not how we were.
Yeah.
But we are all still Black and a part of that African diaspora. And so it's a very heterogeneous experience, diverse experience, but we're resilient people. That's how you and I are on the call today. We
Yeah.
come from hardy stock. We
Yeah.
come from people that knew how to strategize and make do. And I think really seeing Black people, African Americans, and all like us as not simply a struggle or a disparity.
Mm-hmm.
You know, it's a fuller experience there,
Mm-hmm.
survival, thriving, resilience, and coping. So I hope that's what we can bring out even more individually, but through our research.
Yes, yes. I mean, I love the word you just said, thriving,
Yeah,
because that's what we want to get to, right? I mean, really, that's why we do the work we do. That's why we share our knowledge with our community, because we want our community to thrive. One of the things that we're going to be doing soon here is we're going to be joining a mentorship program here. What is the name of that mentorship program? I can't think of it, but they are mentoring young Black men. And we're going to be joining that because we want to help mentor them, help to bring awareness to this field of science, this field of being a doctor, a clinician. So I want to ask, what responsibilities do today's research leaders have to the future generations? I know that's something that I want to do for the future generations. What are those responsibilities, especially to our Black youth?
yeah.
Who may become scientists, and even they might become participants in research.
I definitely think I have had, and I'll be the first to say this, I've
Mm-hmm.
had wonderful collaborations,
Mm-hmm.
networks, mentorships. People have helped me in ways that I am just now really understanding, and I'm sure as I grow older that I will continue to understand. So I think that's the largest responsibility is helping someone see the vision that you may see for them, not say to put it on them or anything like
Mm-hmm.
that, dictate,
Mm-hmm.
but sometimes, especially as we may be in a different place in our lives or we've accomplished certain things, we can see in others what they may not see in themselves.
Yeah.
So it's a responsibility to help cultivate that.
Yep.
Let it be known, like, hey, have you thought about this? Have you thought
Yeah.
about maybe pursuing something in research or clinical medicine? Or how do you want to approach your future? What are your ideas? And here's what I see, and how can we collaborate? Other things that you and I have talked about with here's someone that you may work with or mentor. How can I, as a particular member of a certain network, liaison with that person? Do I
Mm-hmm.
know someone else that can
Mm-hmm.
help? Even if it's an email, a soft introduction, or sharing
Mm-hmm.
your story, I think that helps. And then seeing the full person.
Yeah.
Don't superimpose particular beliefs on them, whether it's because they are Black or from a
Right.
certain neighborhood. Everyone's possibilities are limitless.
Oh my
And
goodness.
I think it would be best for us to remember that. And I would say that I was always sharp, okay? But a lot of people help sharpen me and help me with the
Yes.
language. So I think reaching back to bring forward, and also that it's the job of all of us,
Mm-hmm.
not just Black people, not just other groups, but all of us should be wrapping around Black youth, any youth with promise. And everyone has it. It just takes a day
Yeah.
that something can happen. Great. Yeah.
Yeah, I mean, yeah, no, we definitely want to do that for all youth. The only reason we kind of highlight Black youth is because of all the issues that we kind of have in our Black
Yeah,
community. And
I
so
agree.
I think that it really honestly takes extra effort. Honestly, I feel like sometimes in our communities. And I think as a researcher, as you just said, as a researcher, that's our responsibility. We're in this space. We know that our young Black youth or youth period will be in our shoes one day. So we need to lift them up and help them get there, even if it's just brainstorming sessions, like you said, just helping them to think about the possibilities.
Yeah. I was just going to say, I definitely think the spotlight on Black youth and Black young adults is needed,
Yeah.
for sure. And when I speak to the all portion, I
Hmm.
simply speak to not having these individuals seen as a world apart.
Right, right.
Should be incorporated. It should be
Yes.
just as regular to say mentor Black youth as it is for any other youth.
Yep.
That's simply what I'm saying, to have them on a pedestal,
Mm-hmm.
to have them at the forefront, centered, celebrated, and networked.
Yep.
Because you don't know what you don't know. That is a huge hurdle. And then not discounting individuals simply because they may not know that. And it's a job of course, us,
Yeah.
but I want the whole world to be a part of
Yes.
it because we deserve that. They deserve that.
Yeah.
Those youth deserve that. I just don't think without that focus moving forward in the next 100 years for research with Black people, with Black scientists, with whatever, commemorating and celebrating us, it's not possible if we do not all see that
Mm-hmm.
together.
Mm-hmm. Mm-hmm. So real, so true. I agree with everything that you're saying. So let's talk about the research and what does it mean to design research with dignity at these centers. I'm not working in the university setting right now. I'm not at a center. I used to be. Definitely have a lot of background in that space. But I guess your lens is kind of from the center lens. So how does designing research with dignity look from the university there?
Yeah. I think we would go back to that very first question you had, Dr. Wren,
Mm-hmm.
in that it should be a focus on not only resilience, but relevance.
Okay.
So when you ask a particular research question, because that sets the tone for how you may interface with individuals to join your research, how you have measures that would tap into what we're looking at or what we're hoping to answer the question.
Mm-hmm.
How do we interpret those data? I'm huge on that. Like without knowing communities, Black communities that you're looking to serve, we have a huge rate of error of misinterpreting what we do find. Having it from a lens of possibly negativity or lack of strength or struggle, when it really is, if we just shift the wording one way, it is to note that relevance, resilience, and also they want to be a part of research. People are
Yeah.
curious.
Yes.
So honoring the curiosity,
Yep.
honoring the fullness of the experiences, and then not only that, having that with the individual. Every Black person is not the same.
Right.
Please get to know us individually, but understand our various histories. So I think that is the primary case because that allows us to ask relevant, community relevant questions and scientifically rigorous questions.
Mm-hmm.
The rigor comes in who are we recruiting? Like who would we like to join our studies? So if we're making these major asks about, say, I don't know, migration north or from Louisiana to Chicago, are we going to recruit everyone from Milwaukee, everyone from New York? We need to understand who exactly are we asking to join and why,
Yep.
and then how are we asking the questions? Can people understand them? And I don't mean say read and write, but does it make sense in
Yes.
their experiences?
Yes.
Does it make sense with how they would describe their cardiovascular health, their mental health, their relationships with others? And then are we equipped with histories and presence to interpret correctly? The last thing we want is to put into the scientific register more negative or disparaging information.
Yeah.
So all of those things are at the center of having research with dignity, conducting research with dignity to me.
Yeah. The word that comes to mind is cultural competency. That definitely comes to mind when you were saying that it has to make sense. There's no way that the community is going to even look our way, pay any attention to us if it doesn't make sense. And so that is something to definitely make sure we are doing. What do you think is happening well now? Like, what are we doing well right now?
There are three things I think we're doing well.
Uh-huh.
One, we're having more conversations, transparent conversations with diverse Black communities.
Yep.
Okay, about who we are, what we're aiming to do, why, and how. We know that things change, funding can change, schedules can change,
Yeah.
but I think being upfront about those changes and how we weather that together, I
Mhm.
think is important for continued and bi-directional relationships. So I see that more and more from the institution that I'm at currently, so the University of California, Irvine, to my former institution, Rush Alzheimer's Disease Center. Both of us do a great job at those things, and I see it throughout the country. So that is increasing, and researchers are looking for the best ways to communicate, who to communicate with, and communities are reaching back. So I think that is important. That's one.
Yeah.
Two is researcher relationships with healthcare providers. So how can we make sure that the research findings, the evidence base that we have is applied in some way, whether it's educational materials, how do we communicate with persons who are seen in the healthcare system? What are the barriers, but what are the areas of strength? I will always come back to that. And then lastly, policymakers. So as I am an editor-in-chief, and the journal that I lead is all about implementation, application, and translation. How do we move just say describing an issue or noting challenges or strengths within a particular group, especially Black communities, to actually having policy implications at the local, state, and even federal, hopefully one day,
Yeah.
level. So I see all of that as, all right, we're moving forward for the next 100 years. We may do this. Yeah.
Awesome. Yes, I love it. Since you talked about future and ahead, looking ahead, what do we want to see? What more needs to be done? What does success look like as we build this research ecosystem that is going to include Black communities and other communities of color?
Well, I think I'll keep it to Black communities and Black researchers.
Okay. Okay.
I think we are an inspiring group of people, so this can be applied widely, but for us, we're talking to us now.
Come on.
I would love to see more Black scientists,
Yes.
more Black healthcare providers from diverse backgrounds,
Yeah.
from rural areas, cities, Southern gals to Northern ladies to people focused on the heart, the connections to the brain, to focused on women's health, reproductive, menopause, you name it. All of these things have implications for aging. How do we treat our young girls? All of that. And how do we communicate with each other and share our understandings? So with that, I think I would love to see more Black people in research studies, like having research curiosity, research participation, but
Yeah.
then also spreading the word that we can have solutions through science. So it's not all bad. It's not, say, of the past. We can shape this future in our very strength-based and happy image in terms of
Yes.
being focused and rigorous. I would love to see that, and that requires continuous communication. Everyone knows if you email me, as you know, Dr. Wren, if you text me, I'm going to text back. I'm going to email back. If I
Thank
don't
you, by
know,
the way.
yes, for sure. If I don't have the answer, I will try to connect
Yeah.
you or anyone with someone who can. And I think that's required of all of us to build this ever-growing network. And
Yes.
then I think that inspires others. And
Yeah.
that inspires other scientists, other communities, other just the world. So
Yeah.
I think even if we focus on Black scientists, Black healthcare providers, Black communities, it just seems like a ripple that just
Yes.
is beautiful in that way. So I
Yeah.
hope for that for us. And I think so. I mean, look at all we've done in
Yes.
this short amount of time with all of these things.
Yeah.
Yeah,
No, we're doing it. We're doing it.
yeah.
We are literally, like, when you were talking, I'm like, we are literally Black history. We are creating Black history right now. And that's why we're doing the mentorship, right? That's why we want
Yeah.
to, reach our hand back and pull up the next generation, because we need to make sure that Black history continues on, and that there are going to be more of us in science, in medicine, in biotech. And, I mean, that is really the only way how our voice is going to be heard and carry on and be included, right? So we're doing it. We're moving in the right direction. I am very hopeful and very encouraged by that, because we are doing it. Because talking about like the future generations and looking back in history, what do we hope that we chose to do differently? So I guess the question, what I'm trying to say is when people look back to where we are, like to us, I feel like this is our Black History era. We're building it right now, right? So when people are looking back years from now, what will they say that we choose to do differently? Like, what are we doing differently? I think I have an answer, but I'll let you answer first.
Okay. You know, I think if we're saying that we are doing differently, I hear the question in two ways.
Hmm, hmm.
If what we're doing differently than our ancestors,
Uh-huh.
I would say not much,
Okay.
because we are built on such strategic strength, like strong people, forward focused,
Yeah.
that I hope that they would say that we've continued that legacy.
Yeah.
Yeah, that's what I would hope.
Yeah.
I
Yeah.
would hope that they would say that we were strong, we were resilient, and that we could be strategic as well. And we knew how to do it, because I think sometimes we could be unnecessarily critical of our ancestors and what they
Mm-hmm.
went through,
Mm-hmm.
and
Mm-hmm.
they did more than the best they could
More
with
than the
what
best.
they had.
That's right.
If I think what we would look back on to what we were doing differently as researchers, I think having a voice, being curious, staying curious and in community, and then also keeping the faith and staying hopeful, not being downtrodden.
Yeah.
I think that is the case, because once you get negative or once you get low, it's easy to stay there. But I
Yeah.
think us talking in community, doing this podcast, talking to others, mentoring and being mentored, because I'm still being mentored,
Yes.
that keeps our spirits up.
Yeah.
So I think, I hope that whoever it is looking back like, okay, that's what they're choosing to do, and
Yes.
that's how they're choosing to stay.
Yeah, no, I think that the hope, I agree with you that we have so much hope, like I just said, but it really encourages creativity, which I think
Yeah.
that is, for me, that is what I want them to look back and say they were super creative on how they, pushed forward on these strategies and and the things, because I think it's necessary. We have to be creative because a lot of times doors close in our faces, you know what I mean, in one way. But no, that doesn't mean we give up. I think, like you were saying in the beginning about resilience, we are very resilient, and we're going to be creative in how we can move forward and how we can get things done. I know I'm waking up all the time in the middle of the night like, oh, idea, let me write that down. See what we can do with this idea, you know what I mean? So another thing about, because we have all this creativity and we have these ideas, we are fortunate in our time now to actually kind of see a way forward, to see how that can come into play, like how those things could get done, how these solutions can fall into place. So we can, like, and I think again, for me, I'm all about solutions and making sure after we have talked about the past and after we have talked about what has happened to our community, how are we moving forward? That we have to like continue to be solution based. And so that is kind of what I would hope that people see when they look back on what we're doing. So thank you so much, Dr. Glover. Do you have any final words of wisdom for our community? Our community is full of researchers, researchers listening to our podcast, pharma, biotech, but then we also have community members listening in. Do you have a message for the community, and do you have a message for the researchers right now?
Think for the researchers would be to, if you're not band together, get together,
Come on.
more synergies that we can find
Yes.
together. Just
Yes.
as the body is connected, so are we,
Mm-hmm.
in that way. And it would just be nice to have more people and have fun together. Like you say,
Yeah.
we be creative and think of generative solutions for it.
Yep.
I think if we're talking more broadly for communities, is simply that we are here, we
Yeah.
are strong,
Yeah.
and we're moving forward. We
Yes.
were always here and we always will be.
Yeah.
So let's make it count.
Yes, join with us. Stay curious. That's one of the things I usually tell the community is stay curious. Research is super important in our lives. So stay curious, follow diverse research now, because we are in the community making sure that you are aware of research. So yeah, I thank you so much. I love this conversation. I think it was great for Black History Month and any other time. You're like, this is just a good conversation, period.
Yeah.
Well, thank you so much, Dr. Glover. Maybe we'll have you back on at some point later on and talk about more specifically, some of your research that you're doing, that you've gotten started on the West Coast. All right. All right. Thank you so much. Take care.
Thank you, Dr. Ren. Bye.
Okay. Bye-bye.